Hello, everyone. You're watching KTAL News Now. I'm your host, Anthony Mocklin, and today I am joined by a very special guest who is here to talk with us about mental health in kids. And while the mental health in children is improving across the country, data still shows that there are still some serious challenges being faced right now, along with teen substance abuse and suicide rates. And here to talk with us today is Dr. Michael A. Lindsay. How are you today?
I'm doing well, Anthony. It's great to be here. Thank you for having me.
No problem. And can you tell people a little bit about what you do for those who might not be familiar?
Absolutely. So, I am at the NYU Silver School of Social Work, where I am Dean and Paulette Goddard Professor. I also do research on child and adolescent mental health and how parents can identify and support the mental health challenges that their children are going through. So, I'm just really excited to have this conversation with you.
And what can you tell us a little bit about what the data has been showing when it comes to mental health in children?
Yeah, I'll start right there in Louisiana. So, Louisiana ranks 27th among US states by Mental Health America in terms of prevalence and the prevalence of mental illness and access to mental health care. Young people need our support like never before. According to new research by Mental Health America, among 12 to 17-year-olds, roughly 1 in 6 or 15% experienced a major depressive episode in the last year, and 1 in 10 or 10% reported serious thoughts of suicide. But there is good news, as you mentioned. According to a study from Sergo's Youth Mental Health Tracker, 67% of youth found that talking to a family member was helpful with regard to their mental health and well being. That's why it's so important for parents and caregivers to open up ongoing and supportive conversations with their kids. It's why I'm so excited about the Sound It Out campaign and the Listen In podcast, which we'll talk about some more.
Yeah, could you dive a little bit into more about that podcast and what people can expect, like listeners?
Absolutely. So the Sound It Out campaign is a national campaign from the Ad Council and Pivotal that helps parents and caregivers support the emotional well-being of their adolescent children. The campaign offers free, expert-vetted tools and resources to help open up productive conversations and help to move beyond the "I'm fine" response that oftentimes kids will give us. It includes the Listen In podcast, which can be found on all streaming platforms. There are also PSAs for the campaign airing nationwide, and parents and caregivers can visit the campaign's website at sounditouttogether.org or Instagram to find tips and resources.
And when it comes to parents and what to look for in your children if they're going through something, what are some of the warning signs for people to look out for?
I love this question, and it's so incredibly important. First, I just want to say that kids often cope in ways that bring relief and do no harm, but it can be concerning if they're coping in ways that are or can be destructive. Some signs that a child may be struggling include a sudden change in behavior, sleep schedule, appetite, or appearance. I often say to parents, it's not rocket science. You really want to hone in on changes and behaviors in terms of, or these other, matters that I talked about: sleep, appetite, appearance. If a child was functioning well before, now, and so you notice that discernible difference, that is a telltale sign that you need to hone in on more with respect to what's going on with your child. If you're concerned about your child, again, you can find free expert vetted resources at sounditouttogether.org. You're not alone in this. Oftentimes, parents feel like they may be alone, you can reach out to your child's school counselor or to relatives and friends. We're all on the front lines, and we are able to support uh, children when we are all aligned, all on the same page, and monitoring what's going on. Again, that sudden change in what we previously saw to what we're seeing now is a telltale sign that we need to hone in a bit more.
And I know for some people it can be hard to start those conversations with their children. Is there any tips or advice that you might have to go about doing so?
Absolutely. And again, the campaign and the website, the podcast, the whole nine, it really, really brings out what parents can do and how to get those conversations going. So we talk about how parents can get beyond the I'm fine part of the conversation and develop more trust between themselves and their child. We also cover the unexpected transitions of middle school and high school and the emotional tug of war between wanting to protect your child, but also learning how to let them grow. Parents get overwhelmed too. It's okay if you feel worried or angry while you're talking with your child, or if you feel sad or disappointed if they don't want to talk with you. Remember, it's okay if they don't want to say, or they feel a bit lost and need help outside of you. You don't have all of the answers, and it's okay to acknowledge that.
And to speak more to your point, once you develop that level of trust with your children, how important is it to just fully like let your guard down and just be vulnerable with them to show them that, hey, I hear you, I'm listening, you can tell me anything.
Yeah, I think that's a great point because we have the opportunity to model for our children or loved ones, if you are a caring adult in a kid's life, how to be authentic and vulnerable in such a way as to communicate what is truly going on with you. I often say if you can't talk about something, it's out of control, right? And so having that sense of vulnerability as an adult and that authentic expression of like I don't know all of the answers. I struggle with those matters as well. Even if you, as an adolescent, when you were growing up, you had challenges in your life that required going to a professional for help. I think that's okay to share with your kids because it models for them how to take on those challenges in their lives and what to do in a productive way to resolve them.
And is there anything that I didn't ask you today that you wanted to touch a little bit more on?
Yeah, I just want to say to our listeners that you don't have to have all of the answers. There is help and resources available to you. Obviously, the sounditouttogether.org slash podcast is a wonderful website with so many tools and resources. And I encourage family members, adults, to check it out. Some of those tools may be useful to you, but I also want to mention that if there is an urgent crisis, that there's the 988 helpline that has 24/7 availability with respect to counselors who can talk you through challenges, who can help you get the support you might need for your child, even if it's the you feel like it's you want to be confidential. The conversation can be confidential, except for if there is an urgent need. Then they will facilitate helping you get connected to emergency services. The podcast is incredible. The one that I will appear on will actually air on November the 10th. The first episode is out right now, and I encourage our listeners to go to sounditouttogether.org/podcast to access those wonderful conversations that we're having about how parents can support their children's mental health and well-being.
All right. Well, thank you for joining me and providing some really valuable, important information for everybody.
Thank you for having me, Anthony. And I'll come back anytime you need me.
Awesome. Looking forward to it.
All right. Thank you.
And if you haven't yet, be sure to visit ktalnews.com where you can find all of our breaking, local, and trending topics like this one. And be sure to check out the Sound It Out campaign's Listen In podcast and the episode that drops on Monday to see Dr. Michael Lindsay speak more about this. And if you're looking for any tips, we'll have a full web story on our website at ktalnews.com, which is where we stream this show every day, Monday through Friday at 1 p.m. But for now, I'm Anthony Mocklin. Have a great rest of your day, and thank you for joining us.